Did you know that a small weakness in the blood vessels supplying your brain can cause life-threatening hemorrhage? These are known as brain aneurysms. Today we are going to see what brain aneurysms exactly are, how they manifest with, how to diagnose them, and what are the treatment options available. Brain aneurysms are small weakness in the part of the blood vessel supplying the brain which progressively grows and enlarges and might rupture, causing life-threatening hemorrhage known as subarachnoid hemorrhage. These brain aneurysms can come individuals with high blood pressure, uncontrolled sugars, or even with a family history of aneurysm, or sometimes even a normal aging blood vessel can lead to aneurysms. These brain aneurysms usually can present as either unruptured aneurysms or ruptured aneurysms. Unruptured aneurysms usually present with unrelenting headache for prolonged periods over months, which are not subsiding with medications. Patients might even have vision problems with these unruptured aneurysms. Whereas ruptured aneurysms usually present with typical symptom of worst headache of your lifetime. These patients might even have weakness of an hand or leg, speech problems. How to diagnose these aneurysms? These aneurysms are usually diagnosed with specialized CT scans, MRI scans, and specialized angiograms. Just like a cardiologist does an angiogram of your heart to see the status of your blood vessels, we also perform angiogram of your brain to see the blood vessels and the aneurysms in detail. There are two treatment options available for the brain aneurysms. First is the microsurgical clipping, where the patient is anesthetized and the incision is placed over the skull and a small part of the skull bone is removed, and after manipulating the brain, the aneurysm location is reached and a small clip is placed across the neck of the aneurysm to seal the aneurysm off. But this procedure can be risky in high risk individuals. There comes the second treatment option, which is known as endovascular coiling. This is a minimally invasive treatment where a small tiny hole is placed in your groin and specialized catheters and microcatheters are taken across your neck into the brain, into the small blood vessels, and specialized microcoils are placed into the aneurysm, sealing of the aneurysm. There are also usage of few items such as known as balloons or stents to help in this coiling process. There are also other techniques to seal these aneurysms off, such as specialized stents known as flow diverters, which will reconstruct the artery and promotes aneurysm healing over a period of time. These endovascular procedures ensure faster recovery, a painless hospital course, and a quicker discharge from the hospital. Brain aneurysms, although sound frightening at first, with the help of these modern endovascular techniques, the survival and recovery are much better. If you or loved ones are diagnosed with an aneurysm, do visit an hospital at the earliest and ask for an endovascular treatment option. With regards to brain, the earlier you get diagnosed and the earlier you get treated, the safer you are.